Welcome to Understanding Fibromyalgia with Dr. Pascal Harrison.
Hello, my name is Pascal and I'm going to be talking with you today about understanding fibromyalgia diagnosis. You may have recently been given a diagnosis or you may have had it for a little while, and this very short talk is just going to discuss some of the main symptoms that you may be experiencing and then focus on a few of those. A little bit about how it might affect your global functioning and also about what possible treatment options there is to be able to help cope with fibromyalgia. So this will probably take about 15 minutes of your time, so hopefully you have that time today. So as I say, we're going to talk a little bit about the fibromyalgia diagnosis. So very much the name of fibromyalgia is often connected to how it can affect the widespread pain and the tissues within our body. So the name of fibro is made up from tissues and tendons, and my is meaning muscles, and algia is meaning pain, which very much connects to the main symptoms that people may have when they're experiencing fibromyalgia. Although we do have to say fibromyalgia is not a progressive condition, and it doesn't affect the actual damage to the bones of the body, but we know it can affect the whole pain processing and the widespread pain and areas of tissue pain that people might experience. So I'm going to talk a little bit more about what is fibromyalgia. So fibromyalgia is estimated to affect between 1 to 25 people, so 1 in 25 people. And they've done some research to suggest there is a difference between gender. So there's more females that are diagnosed with this condition than men. And this may be something you've noticed with your condition, that it can fluctuate within the day, within the week, within the month. And we know that this can vary from case to case, from person to person. Some of the main symptoms that you might have noticed are the widespread pain. So this is thinking about on both sides of the body, below and above the waist. You may notice that you're having tenderness in the muscles and joints through the body. And often it's experiencing pain in the body for 3 months. And this is really important because often there's a distinction between acute pain and then persistent chronic pain. So acute pain is often those that may have had a damage, so they may have had a broken bone, or they may have had a tissue damage, and people may experience that acute pain. Persistent chronic pain is when people experience it for a much longer period of time. And this is what can happen with those experiencing fibromyalgia, that people may be experiencing it for much longer period of time. We're sort of looking at above 3 months. So just thinking about some of the main symptoms of fibromyalgia that you might have noticed experiencing. Some of the common symptoms are being able to notice that pain in the muscles, pain in the bones, general fatigue. So often people experience feeling exhausted, feeling like they don't have the energy within the day to undertake activity, headaches or migraines. People also may have difficulty with dry eyes, and this may be a symptom that some people experience. We know that there is also a link between mood and fibromyalgia. So some people, when they have a health condition that's affecting their areas of their life, this can then affect how a person feels. It might cause low mood or anxiety. But also there can be other groups of people where they may already have a diagnosis of depression or anxiety, and having a pain condition as fibromyalgia, this might make their symptoms worse. But we know there is a link between mood and fibromyalgia. Often it can cause problems with concentration and with memory, and this is something I'm going to talk about in a bit more detail later on. And people can have problems with their sleep. So people can often report unrefreshed sleep. They may go to bed and may have had sleep, but feeling that it's not good quality, sort of waking up feeling like they've not been to bed or had any sleep that makes them feel that they have that energy. We know that also it can affect a person's bladder. So people have noticed it can cause things like pelvic pain, and it can cause things like irritable bowel symptoms as well, where people might have difficulties with their sort of bowels as well. And some people may report some palpitations. So for every individual, some of these symptoms might be affecting you, and for other people may not. And also can depend on the level of these symptoms. Some of them can be mild, some of it can be moderate, and others, for other people, it can be more severe. So thinking about other symptoms and other diagnoses which are linked to fibromyalgia. So as I said, like headaches and migraines are often linked to fibromyalgia. People can have like muscle spasms through their body. Underactive thyroid gland problems also can affect people. Restless leg syndrome, so this may begin having those spasms in their body, which is involuntary, and often people may experience these symptoms at night time. There's also a link between inflammatory conditions such as osteoarthritis, and also there's some research suggests that there can be some link between chronic fatigue syndrome as well, so people may have similar symptoms to that and may have that diagnosis as well. So thinking about your time of going to the doctors and going through the different tests to have a diagnosis of fibromyalgia, you may have noticed that you've been to see GPs and other specialists within rheumatology clinics or within pain management services. So you may have gone and seen very different people to come to this diagnosis. And they've done some research suggests it can take on average 5 years before a diagnosis is made. So this can feel like it can take quite a long time before you come to an explanation or a label for some of your symptoms. And I realise that may cause additional stress or may cause some anxiety about what might be the cause of your widespread pain. So thinking about the causes of fibromyalgia, at the moment there is no specific cause of fibromyalgia. This sort of remains unknown. This does not mean that this condition is in a person's head, and some people might sort of worry about this. But what we do know is actually it means the body is more sensitive to pain, and it's a condition that affects the nervous system. And often there's been the link between changes to neurotransmitters, which help to be able to regulate our whole pain system. And we need a right amount of the neurotransmitters within our body for it to work well and be effective. And serotonin, noradrenaline, and adrenaline, and dopamine are some of the main neurotransmitters that work in part of that circuits within the pain pathways. And studies have shown if there's any changes to these neurotransmitters, this can cause widespread pain and aches that a person may experience within fibromyalgia. So at the moment we sort of know there can be that heightened sensitivity within the pain processing system with fibromyalgia. So thinking about some of the possible triggers of fibromyalgia, which might sort of link to some of the causes, and there's been different studies and different research that's gone on, and these are some of the main common factors that can affect the onset of fibromyalgia. So a person may be experiencing life stress. Age also can be a factor, that people are more likely to be age 40 plus that have diagnosis of fibromyalgia, although younger people also can experience it. And thinking about genetic, there's been some research that if you have a family, there may be more prevalence of fibromyalgia within a family. Viral infections, quite often when people report their history, people may have had a viral infection before the onset of the symptoms, but this is not exclusive with everybody. A person may have experienced some form of trauma, and this may be one of the possible triggers. An imbalance with brain chemicals, and also, as was said earlier on within this talk, that there's more likely to be females than males that experience this condition. So these are just possible triggers, not saying that this may be the main cause of your condition, but you may sort of notice whether any of these factors might have affected you within the journey of your diagnosis. So how is that diagnosis made? This is often made with a GP or someone from rheumatology or specialist pain management service, and they do this by looking at the physical examination. They may rule out other possible causes using other tests like CT scans and blood tests. So the main criteria for fibromyalgia is that generalised widespread pain across the body and having these symptoms for at least 3 months. And there's no other disorder that can explain the symptoms. There's no other possible cause. So this is how the diagnosis is made. So thinking about some of the main symptoms of fibromyalgia, sleep can be one area that people can notice, that they may have that unrefreshed sleep. And this diagram sort of explains that sort of relationship between sleep, sorry, I just skipped a slide, between sleep and that muscular pain. So as we can see, we can have the pain within our body. If people have any other illnesses as well, this can then affect a person's sleep. And then life stress as well, which can also mean that can affect a person's sleep. If we're sort of worried about other issues within our life, that can make it really difficult for us to be able to get to sleep. And then that can cause a whole sleep disturbance, and they can cause that difficulties of getting that restorative sleep that we need to feel that we charge and we have that energy to undertake activities. And then it sort of helps to increase that widespread pain, fatigue, and those tender points within our body. So we can see there's a whole relationship between our sleep, our mood, and also the fibromyalgia that we might experience. And there may be some suggestions of looking at ways of helping with your sleep. So this might be thinking of any sleep habits that might promote feeling rested and feeling calm before going to bed to try and sort of help with your sleep. And perhaps if there's any ways to be able to manage any stress within your life can also help to promote that sort of sleep cycle for you. Another main symptom with fibromyalgia is difficulties with memory and concentration. And some people may have used the term of fibro fog to be able to explain this. And this can cause like memory lapses, difficulty with concentration, and being able to stay alert. And for some individuals, this can be one of the most distressing symptoms that a person may experience within the diagnosis, because it may feel that it's difficult to be able to pay attention and engage in activities that you may need to. And there may be different aids and devices that might help people to remember and prompt them with different activities and things they may need to do to try and help with their memory and concentration issues. But we know that this is an area that can affect a person, and this can be quite a common symptom within fibromyalgia. So thinking if we're experiencing widespread pain and we're feeling fatigue, often this can mean a reduction in activity that we're doing, making it really difficult for us to maintain our daily activity. Sometimes this can cause then what we might call a deconditioning of our body. We may lose some of that functional capacity that we have, and then that might lead to further concerns and worries about undertaking movement because of fear of pain and fatigue. And some suggestions is doing small amounts of physical activity can help us. And thinking about some of the benefits of doing some physical activity, so sort of any movement that we can do, we know that that can help us to be able to interact with others and to help improve our mood. And that activity doesn't have to be really high physical activity. It can be being able to walk and general stretching that can help us. So I'm going to touch on now about some of the possible treatment options with fibromyalgia and sort of ways of how you may be able to help ease that pain and fatigue. So here are possible treatment options with fibromyalgia. So medication is often used, so there could be medication for pain. Some of the possible options are tramadol and paracetamol, or people may have antidepressants to be able to help manage their mood and sleep difficulties. And this is something where you'll be able to get more specialist advice from your GP or other specialist services that you might be working with about possible medication options and what they would recommend, because we also have to consider that other people may have other physical health problems and other medication, so you want to be able to make sure that it complements what medication you're already on. Also thinking about exercise, as we've talked about before, being able to do some exercise within the week can be helpful to be able to keep our body moving. And there's some recommended guidelines of being able to do 20 to 30 minutes 2 to 3 times a week. This is a guideline, and it may be something, if you're not doing this activity at the moment, something you can work with, and it may be using what we might call pacing to be able to increase that level of activity so that you're able to do some activity within the week. CBT, which is cognitive behavioural therapy, can also help with being able to gain tools and strategies to be able to help any problems with your mood and to be able to help ease your pain. And they sort of look at different ways to be able to help with any thoughts that you may have related to your pain or your condition, and being able to give you those tools to help manage that. Also, things like relaxation and mindfulness can also be helpful to give you some more tools to help manage by being able to help keep you calm and able to reduce that stress for you. Physiotherapy is also another aspect of treatment for fibromyalgia, and this will be personalised to your specific symptoms, and often your physiotherapist will be able to provide you with guidance about postural habits and how to look after your joints and use of physical aids. And the idea of this is to help improve your pain and improve your quality of life. Acupuncture also is another technique that people might use to be able to help relieve their pain and also possibly sort of massage. Diet also can help people, especially if they may have symptoms related to their bowel or have irritable bowel symptoms. So diet may also help to ease that. Also, we know there's a link between diet and also sleep, so being able to reduce that sort of caffeine too late in the day, which can act as a stimulant to keep you awake. So diet also can play a role, and these are just possible treatment options, and it may be best to get some guidance to what might be the best route or the combination of different treatments for you that you may be able to undertake and to help you manage your condition. So in summary, the main symptoms of fibromyalgia are sort of widespread pain, fatigue, unrefreshed sleep, and also concentration issues, which we might call the fibrofog. There's no specific physiological mechanism, but there is sensitivity in the central pain pathway. And there are other symptoms which are common to fibromyalgia, and these are like irritable bowel syndrome and osteoarthritis. At present, there is no cure for fibromyalgia, but there are treatment options, as we've discussed, that may be able to help ease those symptoms and help you have a better normal. Thank you so much for listening to me. And on the next slide, there is a list of possible resources that you may be able to access if you're interested in being able to read more about the condition and how you may be able to manage it for yourself. And there's a list of resources and books you may be able to access. So I hope you found it useful, and this is something you may be able to discuss further with the person that you might be working with in the future. Thank you so much. Goodbye.